We're going to wait for that. It's all AJ's fault. Patient Pecha Kucha, patient chit chat. Hello, innovators. Welcome to the future of mental health care. Patient Pecha Kucha will give a perspective which has been absent too long. The view of the client. Last year, I had the chance to visit Kids Health Phone in Toronto, and I was blown away by something I heard from the counselors, that the child on the phone is, in fact, the expert, not the professional counselor, the child. Patients are the experts on themselves. High school, we've all been there. Ooh, was that a nightmare? Well, it was a little bit worse of a nightmare for me because I actually came forward in grade 12 to my very trusted teacher, and I told her about my 8 years of physical and sexual abuse that I had endured. I was greeted, I was cared for, I was comforted, I was supported. Fantastic. Lucy, we're all accommodated with her. She's my favorite psychologist. 5 cents, wow, I wish. One of my favorite therapists, Lucy, always messing with Charlie Brown. As we know, he's always trying to kick that football. Well, if Charlie Brown were to go and kick that football, and Lucy again pulls the football out from under him, and what if Charlie Brown breaks his leg? Well, he's going to have WCB compensation. He's going to have a physiotherapist. He's going to have doctors. He's probably not going to have to wait in line. And he's going to have the best free health care available. Now, if Charlie Brown were to have some anxiety over Lucy always messing with him and always taking that darn football away from him at the last second, well, Mr. Brown, you're going to have to wait 4 to 6 weeks, and you might get a counselor. Oh, if you don't want to wait 4 to 6 weeks, well, we can get you in with a private therapist, but they are going to cost a little bit. See, inflation hasn't been kind to psychotherapy. Lucy cost 5 cents. In our modern world, it costs a few $100s. So, looking at child and youth waiting rooms, we saw earlier where colors, vibrancy, environment matters to the patient. We need to create supportive environments before and after. We need cookies. The waiting game. As Canadians, we're naturally patient people. Courteous, masters of waiting in line, especially in Vancouver with the Olympics. But mental health, patients can't wait. Patients who wait in mental health die. Talk therapy, I have to go and I have to explain everything that I've done in the past 7 days. I have to explain my emotional strains. I then have to get tools from my therapist, and oh, we have to do all that in an hour. Oh, and I can't email him because there's privacy issues. So what happens? I get medicated, and I'm happy. But what happens if I don't get professional care? Downtown East Side, one of the major civic issues in Vancouver. Growing population in the Downtown East Side, youth, young adults. We also talk about things in the Downtown East Side. We talk about prostitution. We talk about drugs, alcohol, illegal activity. Rather than seeing these things as individual causes, I see them as coping mechanisms, because a number of people in the Downtown East Side are undiagnosed patients suffering with a mental illness. So luckily, as we saw there, I grew up in a little city called Chilliwack. That's that city before Hope that you have to get gas in if you want to go into the interior. Now, don't let the white picket fences fool you. Suburbia has its issues too. Self-harm, suicide, alcoholism. These are all coping methods that have been developed by people in suburbia who have a lack of access to care. Now, that lack of access to care, again, is those wait times they were talking about, that lack of access to care for me as a patient in particular. I went through school, I lost all of my care team. And guess what? We're all filling things out on paper, and unfortunately don't have a unified network. So when I went from Child and Family Services to Adult Fraser Health, guess what happened? I had to re-explain everything. Guess what? As a survivor of sexual abuse and physical abuse, I really don't like repeating myself. It actually, believe it or not, invokes a lot of anxiety and trauma. So what do we need to do? Go digital, get rid of the cart. Simple enough. Now our psychology system, mental health system, we're at a boiling point. In fact, we're code blue. We're about to explode. 10% of people suffering with a mental illness will get professional care. Now, here's an alarming statistic, as a lot of you in this room know, or you perhaps are. It takes 14 years to train a psychiatrist. So if somebody goes into school from today, well, you do the math. It takes 6 years to get a master's in psychology. We don't have time to fill the staffing gap to deal with the patient volume. So if we were to go to 15% of patients getting care, we don't have the support. So what's the solution? Peer support. Peer support is something that's brand new to BC and is officially now a position, and it's our ace in the hole. Peer support gives an opportunity with a short amount of training for a person who's walked in a patient's shoes, who's been there to give comforting, real-life, fundamental access to information, whether it's transit, whether it's buying groceries, whether it's a daily routine. These are mental health fundamentals where, at the end of the day, we want our patients to be highly functioning individuals. Clubhouse, not in a tree, in our communities. Clubhouse is a huge opportunity. CMHA is a huge ambassador of it with their recent launch of their ECHO program, where patients can interact outside of a hospital, outside of a 1-hour session, and what do they focus on? Well, they focus on what the patients want to focus on. So, innovators, as you all are today, first off, I'd like to thank you. Innovators, change makers, whether you tweet, you email, you Facebook, or you kick it old school with pen and pencil still, nothing wrong with that. Take the conversation that exists today and take it into your fields of expertise. Change the conversation. Talk to your patients. Change is possible. If I could quote a famous president, yes, we can.